Good afternoon. This is Barbara Brandt, Director of the National Center for Interprofessional Practice and Education. And we're here today to present a third in a series of webinars connecting at the Nexus COVID-19 edition. And we've entitled today's presentation, Building a Stronger IPE Program, to document what you are learning today. Sean, you want to advance the slide? So I want to, on behalf of the American Interprofessional Health Collaborative, Gail Jensen, who is the current chair, welcome you to this webinar series. And again, this is the third in a series. So we started these last week, and it's a series of web-based discussions, webinars, and forums to foster conversation, learning, and resource sharing among leaders in interprofessional practice and education. Each of these sessions are recorded and they're archived so that you and your colleagues can access them later. And this is the URL for future sessions. We'll be sending out the URL after this webinar. So today, I'm actually going to present today with Laura Pesa, who's the Director of Evaluation in the National Center. Laura has been with us since the beginning of the center and conducts the evaluation of the center, but also works on quite a number of projects and grants in addition to those in the National Center. So the topics and what's on our mind in these short few weeks since the realities of COVID-19 has hit us is that we're going to talk about strategies for IPE champions to document what is happening during the COVID-19 pandemic to build a stronger program for the future. We're going to introduce concepts of IPE knowledge generation, developmental evaluation, and issues relative to data collection during humanitarian efforts. And then we're going to share with you a tool and strategies that we all can use together. So Laura?
Yes, so we are going to try to make today as engaging and interactive as possible. In a time where we don't get to see each other in person, we really do want to hear from you, both in writing and from your voices as we get into the discussion at the end of today. And we are going to leave quite a bit of time at the end to discuss. So we're going to be engaging and interacting in three ways. We will have a community poll, and that's by invitation. We will tell you when the poll is going to pop up and how you can answer. There will be a chat available throughout. So as we are sharing stories and giving examples and talking through our topics today, please feel free to share at any time in the chat box what you're seeing and experiencing, your examples. And we will be recording all of the chat and be returning that to you as well so that we all have a record of what we talked about today. And then finally, near the end of the webinar, we're going to have a discussion where, again, we do want to hear your voices. And we're going to be using the Q&A function to do that. So you'll use the Q&A at the bottom of your screen. You will type in your question. And then Sean Diego, our moderator, will make sure we know what those questions are. And we'll be able to call on people, unmute you, and have a discussion.
So these are examples of trends that we are noting and with conversations with IPE leaders and teams across the country. So we're seeing and hearing things about certainly the rapid response in health systems. You can't open up a page in the New York Times and the like to know that that's happening. We're also seeing multi-sector interprofessional collaboration. So collaboration way beyond the health systems sector. We and many people on this webinar today know this better than I do probably, is that overnight innovations in education delivery across the entire continuum and leveraging technologies in new ways. And then another observation is integrating students into meaningful responses and in the pandemic responses and into communities. So as students, particularly who are in their experiential education years, cannot go into health systems for rotations, we're seeing very innovation in integrating students into meaningful responses.
So we're going to dive in here with some interaction with a poll. The poll question is, to what extent do you see opportunities for the future of interprofessional practice and education during this time of COVID-19? And so this poll will open up and we will give you 20 seconds to answer.
Okay, it looks like go ahead, I'll let you to note what you're noting, Laura.
Well, you're all seeing what we see, which is that 65% of us feel that there are some significant opportunities for positive change in this realm of interprofessional practice and education as we're going through this chaos of COVID-19. And then, just a few people on a little, moderate, and some, but for most of us, we see some significant opportunities.
So we would agree. And our observation is that what's happening today is a lot like what we've been espousing for IPE for decades. And frankly, it's happening overnight. And so that's what this webinar is about. What does this mean? How can we document and reflect upon the opportunities that we all are seeing during this particular environment, as difficult as it is? So the National Center, as many of you have followed our work, knows, has been built upon the concept of the Nexus. And that is redesigning both education and healthcare deliveries simultaneously to be better integrated and more interprofessional for improved outcomes. And we have focused first on the triple aim and more recently on the quadruple aim. So those are up on our screen. And the changes that are occurring in the last several weeks, I would characterize as extreme nexus. So to us, it's a time to take stock and to look for the opportunities that is moving, frankly, what our vision has been very rapidly. So Laura?
So one of the things we did right away as a National Center was put out a call for stories, for reactions, for people to tell us what you are seeing on the ground out in the field during this time. So we're going to share a couple of those examples and stories that we have heard that we asked for in the last couple of weeks. So the first is shared from a Duke University clinician and faculty member. I work as a nursing practice coach. I'm currently working with an interprofessional team of palliative care providers and clinical support team members, nurses, physicians, APRNs, social workers, chaplains, clinical leaders, to enhance their current telehealth services to increase access to all of the over 1,500 patients we serve. We're developing new procedures for efficiently delivering telehealth services that include video visits, telephone visit standards, and remote monitoring. We're also working on launching a screening tool for COVID-19 symptoms that can be deployed using the telehealth software that we have. This could be a game changer for the patients and families this provider organization serves. She goes on, as a Duke University School of Nursing faculty member, I've offered to explore options for providing telehealth clinical experiences for students who in many cases are not allowed to continue their current clinical area. If this could be established, it would not only provide students with a viable option for obtaining required clinical hours they need, as well as a unique opportunity to experience interprofessional education and collaborative practice. So this really shows us both on the clinical and on the education side what's happening during this time. And again, I do want to reiterate that as we're sharing these examples and stories, we welcome you to share your own in the chat. The second example shared from, you're going to have to help me with this, Barbara, Deauville?
Mhm.
College.
In New York.
New York. My team has put our interprofessional simulation program on Zoom with using pre-recorded videos of interprofessional groups from earlier this semester. We ran our first group of 15 learners from 9 health professions on Monday evening, and it was a great success. They followed our patient throughout a year of his life in 4 different healthcare scenarios. Live debriefing occurred on Zoom immediately after. For the last debriefing, the IPE group held a discharge planning meeting to decide on next level of care. We ended the evening with everyone giving their thoughts of how their professions can contribute to this COVID-19 pandemic. And I'll note that, that this person also shared that they are doing this regularly now, several times a week.
So again, we encourage you to share your stories during chat, but we also have other functions on the website, and that's where these have come from. And people continue to share their stories. We also like this one from MGH Institute. I am using social media to highlight the role of respiratory therapists during the pandemic. There is a lot of reference to physicians and nurses, but little to none about the critical interprofessional collaborative work of RRTs on these teams. I am a speech language pathologist. So again, recognizing the full spectrum of team members. So now we're going to, these are the stories. These are examples of stories that we hear every day. You're sending them to us. We're talking to a lot of people. And we think it's an opportunity for collective wisdom. And so we're going to shift into observing, documenting, and telling the story for a stronger future for IPE. So I'm going to introduce a concept that we've been working on for quite some time in the National Center. We've got a lot of experience collecting data. Matter of fact, there are quite a number of people who are on this webinar who have submitted data to us, and we've learned along the way a lot about conducting research and have shifted to a thinking about something called IPE knowledge generation. And we have a paper that literally was just accepted in the Journal of Interprofessional Care that talks about, that shares what our current thinking is about data collection across the nation to learn more and more about IPE. So knowledge generation blends traditional interprofessional research and evaluation approaches, but we've been working on how can we leverage the burgeoning science of big data used in health systems worldwide. And so we have partnered with informaticists, educators, clinicians, health services researchers, and the like. And we're using the platform that's been developed for the Clinical Translational Science Award at the University of Minnesota and their national network and research. We have identified a core, essential, standardized, and shareable and comparable data. And in the case of IPE knowledge generation or any knowledge generation, you need to have this information exchange platform, which we have developed. And we are in a pilot phase for launch. So you'll be hearing more and more about this work. But one of the reasons we're talking about it today is we're going to be leveraging an aspect of this work that's already created to document stories now, what we're learning together, what are we observing to build a brighter future for IPE. And then this information exchange supports collaboration while it's linking locally generated data on individual programs to additional data across programs. So that's a theme you're going to hear us talk about. And Laura and others in the National Center have been very integral to bringing up this concept. Laura?
So in my field of program evaluation, one of the approaches that I find is very, very appropriate for the time that we're in is developmental evaluation. So we just wanted to put out some reminders and just get everybody on the same page about what this is and how this really relates to how we can collect data and tell our stories right now. And this is really an integral part of the knowledge generation concept that Barbara just described. So developmental evaluation was coined by Michael Quinn Patton And it's very suited to situations that are highly emergent and volatile, when the environment is always changing. And I think we can all agree that's where we are right now. It's difficult to plan or predict because the variables are interdependent and nonlinear. Socially complex, requiring collaboration among stakeholders from different organizations, systems, and sectors. Innovative, requiring real-time learning and development. So this is all to say that in times like this, we don't have a static model that we can be evaluating. It really is looking at the situation, understanding it, orienting ourselves in real time, and figuring out what are the best methods to collect data and understand what we're seeing. Next slide. So in developmental evaluation, generally, we have two streams of data. The first is information that assists in validating decisions, approaches, or assumptions. And so this is where we are constantly monitoring and looking at data. And I'm using data pretty loosely here. It's all the information that's coming in at us, and that includes really observing the context. And this we want to communicate in real time to affect change. So using all the data at our fingertips to bring it right back to our teams, to our leaders, to everybody that is making a difference and trying to make change, so that they're doing that in a data-informed way. We don't want to wait till the end to collect data and communicate it. Second is documenting the innovation process. And that's really where we're going to focus our time today. And that's tracking and documenting events and decisions to provide a robust memory of how and why a particular path emerged. So we really want to, right now, record, document everything we can. And we won't know until later with a lot of it, what's important and what led us to the path we end on. But we want to capture this rich history while we are in it, so that we don't lose that memory. So part of what we want to focus on at this time is data collection that is easy, that is naturally available, and that isn't going to be a burden especially to the people that are really in the front lines during this. So capturing existing data is less resource intensive than generating new data. And we know that right now conserving resources is paramount. So people's time, people's energy, money, we need to conserve those things. And we can be of service by documenting the story of this pandemic in the least obtrusive and burdensome ways possible to those on the front lines. So for those of us that are not on the front lines, that are not actively caring for COVID patients right now, this is one of the things that we can do, much like wearing our masks or staying at home. There's a parallel here that the people that are on the front lines don't have the time to write down the story and record what's happening, or even to process or reflect on it. So that is a service that we can do so that we come out on the other side with a rich history, again, of what happened that can help us to improve IPE in the future. So we do this through artifacts. There are lots of examples, but email exchanges, web conference chats, that's one of the artifacts that we are collecting right now as we speak to you. Communications of policies and procedures and change over time. So we're all getting messages every day from our presidents, from our leadership. So what are those communications and how do they change? Schedules, work plans, agendas, and timelines, and how they're changing. And reflective journals and notes. And again, part of what we're going to be talking about is how to reflect as we're collecting data right now. And just to know that sometimes the absence of something is most important to note. So there are some relevant evaluation principles, things to keep in mind from humanitarian and crisis response evaluators. So these come from, summarized from organizations like UNICEF, United Nations, Red Cross. Response needs always come first. So we may want data, but resources, time, participants, and information shared, that needs to go to the response first. Time constraints, priorities, and safety of those affected are prioritized above all other data considerations. So you may think it's a great idea to send out a survey right now to see how everybody's feeling, but for those that are really at the height of this, they don't have time to answer something like that. So those are the types of things that we need to be thinking about. Do no harm. So there's uncertainty, conflict, politics, and we're also going to be dealing with a lot of people with a lot of trauma. So in thinking about how we reflect on this time, how we gather information, being very, very attuned to the continual trauma that could cause for some people to talk about it. And again, a lot of people are facing this uncertainty and may not be able to speak out. So we need to be really aware of those situations. We want to build narrative histories through multiple perspectives and triangulation. So how can we understand what leadership is saying, but also what team members are saying, what patients are saying, what communities are saying. Flexible, tailored, and adaptable plans are crucial. And then we want to be skilled evaluators with deep context understanding, and that's all of you, relationships, credibility, trust, and humility.
Thank you, Laura. So Laura's I've given you the background on what we are going to be really writing more and more about as what we see as IPE knowledge generation, which is learning together, collecting data together. Laura has described developmental evaluation, which we think there's a marriage here in this particular environment. And then sort of the ethics of humanitarian evaluation. What I'm going to talk about now is a little bit more about the information exchange that we have programmed. It's ready to go, it's being tested, but there's a feature of it that we had already built in that we have taken out of the exchange, which is a comprehensive look at data about interprofessional practice and education that we think is very relevant to helping and supporting documenting what is going on locally and then nationally in the field of interprofessional practice and education. So this is a graphic of the infrastructure of the functionality of the National Center IPE Information Exchange as it has already been built, leveraging the Clinical Translational Science Award and other big databases at the University of Minnesota. So we have identified an IPE core data set. You'll see a little bit of that today. So it's standard measures so that it can be comparable and shareable across environments, and looking at key elements of interprofessional practice and education and that interconnection between education and practice. The part that is relevant today is the National Center Data Repository. So it is a secure, it's a HIPAA and FERPA compliant infrastructure that allows data sharing across, and it's housed here at the university. It's also PHI, personal health information protected. It has been programmed, and you'll see this today, for an informatics-driven dashboard. So local programs get a dashboard of the data that they put in 24/7, and it's standardized across programs and has the power for advanced analytics, and then allows program leaders and program management to have the ability to access data with their team members about their own programs and support them making decisions. So again, this has been programmed. I've expedited the programming very specifically for this particular purpose, because what we have been seeing in the last month is so historic that we feel it's absolutely essential that we document what is going on today. Sean. So what is on the right-hand side is the IPE core data set, and I'm not going to talk about that in great length today, but it is a programs are capturing data in this course data set. What I am going to talk about is a feature that we built into the core data set that we call critical events of IPE. And I'm going to describe sort of the history of why we thought this was so important. We have been collecting stories since 2014 across a network that have worked with the National Center, asking them to document stories, or we used to call it critical incidents, that seemed to be a fork in the road for their program. We were seeing common critical issues that were either causing lots of barriers for IPE implementation, or in some cases represented real opportunities. And after collecting over about 150 of these, we had an evaluator do a quality analysis of them, and these themes emerged. So we often see in IPE staff changes, sometimes overnight. We have seen events where people who have designed IPE programs need to change their program strategy. Ironically, number 3 was unforeseen external forces. And so that was the one that caught our eyes as we've reflected upon the pandemic. Often external partners change. For example, a partner will drop out of an IPE program. Sometimes internal partners. So for example, if we were talking about a university, we might have a college or a program drop out of an IPE program. Difficulty obtaining program data, and then money or resourcing problems. These were the very most common themes and variables that we have seen in critical events of IPE. What's been very interesting studying these events as they impact an IPE program and the champions of the program is they can have a positive, negative, or neutral impact on the program. So often people are confronted with these and they think immediately that it's going to have a negative impact on the program. But actually over time, it ends up having a positive impact because the people who are involved in IPE have gotten out in front of it. They've done something to change their circumstances or take advantage of these events. And then sometimes they have absolutely no impact on the program at all. But again, these are what we've been talking about as we look at the trends today, particularly unforeseen external forces, as the nature of what we think needs to be documented today. So next. So we are going to be opening up this feature of our information exchange for those of you who would like to use our system to document. And so Laura and staff have been working with our programmer to expedite a registry process. And so it's going to be open for all. We included, so there'll be a timestamp, as you can see, but we included these emerging categories that we are seeing with COVID-19, but we're keeping in the critical events of that's already been programmed in, the routine critical events of IPE. So Sean. So you would, as you go in, you would click on the unforeseen events, and we have put these categories in. Changes, and again, this is drilling down more to in the trends that we are seeing. We are definitely seeing changes in composition of teams in very different ways. We are also seeing changes in health professions regulations, such as licensure in states, scope of practice, and the like. We are also seeing our colleagues in IPE with expertise in the field are actively being sought out to help address a COVID-19 response, such as team training or working across professions. We heard this last week from Creighton. There's no question we're seeing telehealth, virtual and online clinical care. And relative to, well, I'll talk about that in a minute. We're also seeing interprofessional education programs moving to virtual and online. And then new payment models in response to COVID, and particularly, or an example is telehealth. And then professional deployment in new ways, or workforce optimization, relaxing scope of practice, and for example, deploying medical students. Some are licensing students who are close to graduation in some states. And then there are many of these that we have no idea what it is yet. So there's an other category. Next. So already built into the system in the traditional critical events, we have been capturing once it happens, just like we asked you in the poll, is how do you, what do you think the potential impact of the critical event is going to be in the long term on your IPE program? We encourage people, and they have for a long time, named the nature of the critical event and then summarizing it. So that's a journaling. And then what actions or changes in the program, if any, would you take in response to the critical events? Laura, I'm going to let you talk about this one.
Yeah. So one of the things that is, again, already programmed into the system are reports that you can get right away about your critical events. So anything that you enter in will be available for you to see. It's in your dashboard right on the screen, so you can access that anytime. And then there's also an aggregate report that you can access. So as this time goes on, if you are recording critical events of IPE related to COVID-19, there will be the categories here, and it will show quarter by quarter how many of each type of these critical events of IPE you saw in your program. You'll also see that we have it color-coded for negative impact, neutral, or positive. So at a glance, over a year, you could really see how many critical events of each type did you record as a program, and in your view, were they positive, negative, or neutral? Now I see a question, somebody asking to talk about what it means for an event to be resolved.
Great question.
Yeah, it is a great question. So when we talk about an issue being resolved, this could be something where, say somebody leaves the organization and a great deal of upheaval happens. And so it will take a while for that situation to be resolved, for somebody else to get hired, or for people to be reassigned, or for a team to reemerge out of that. So the resolution is, it could be something where you're reporting and you're saying, yep, this is already resolved. This thing happened, we dealt with it, we're moving on. But some things are going to take a while. So one of the features of the system is that once you put a critical event of IPE in here, if it's unresolved, you will get a reminder every quarter saying, hey, has this been resolved yet? And it's really a trigger for you to come back in and think about what happened, and think about, okay, what has happened since that happened? And has it resolved this critical event in our minds? Do you have another example?
Yeah, I will. So we have helped implement IPE as coaches across the United States. And we had a program that received a grant, and they had a practice partner, an education partner. And within a month of receiving the grant, the practice partner pulled out of the partnership, that they realized that they couldn't deliver on what they had promised. And so here it actually was in a rural area, and the education partners were very concerned about whether they were going to have to send the grant back. what happened is another partner stepped up to the plate, and the partnership actually was much stronger than it had originally been designed. So again, it's what is happening now, what's my reaction to it? How can I reflect on it? And then monitor it for, how is it resolved? And this system is built in to remind you to do that reflection. But again, you're the one that's going to have the record of this particular program. One more example, we had another project that lost quite a number of members in their team. And for a variety of reasons, the program got behind significantly. And when it came time for budget time, they had no documentation of what had occurred in the program. And so we had to actually help reconstruct as the person was going to the administrator to ask for more funding for the program. So again, while we want to do collective wisdom, this is your record for your own program that you have to keep of your own situations.
That's actually a great segue into what I'm going to talk about next on the next slide, which is our local programs, Critical Events of IPE. So part of my work is as the lead evaluator on a HRSA grant with the University of Minnesota Family Medicine Department. And it's a GWEP grant, Geriatric Workforce Enhancement Program. And the National Center has partnered with this grant with me as their evaluator, but also to work in the information exchange system to collect our data. So a couple of the things that I have been doing as COVID-19 has progressed is checking in with all of the project partners on our grant. So we have 13 different projects going on, led by different faculty across the university. And as you can imagine, quite a few changes have happened. So I'm checking in now, and I am using the system of Critical Events of IPE to record what is changing right now and why. So one of those things that has happened is our clinical component has been postponed. So a huge part of our grant was to bring age-friendly practices into some family medicine clinics near us. So an FQHC, another family medicine clinic, were going to be our pilots, and then we were going to expand that to basically our whole Fairview system of family medicine clinics. So we had clinicians and students who were going to be trained in these age-friendly practices, and then we were going to be collecting data on that along the way. Well, we were about to launch that when COVID-19 happened, when our medical students and nursing students got pulled out of those clinics, and when, of course, our frontline clinical staff are not focused on age-friendly practices, but focused on keeping their heads above water. So that is a critical event that I am recording and that I'm monitoring very closely. And the PI of our grant has shifted focus completely to just trying to help them in any way he can with their clinical response.
So Laura, I want to make two comments based on your story. One is Laura has a lot of experience working particularly with HRSA grants, helping with reporting and data and the like. And so what we've designed here has been for this documentation for grants. She had an eye towards what are the things that I've had to fill out on various reports and what could be helpful for support. The second thing I want to say is the person who asked the question about what does it mean for an event to be resolved actually has given us a good prompt, Laura, in that we've changed an educational activity from in-person to online. I imagine resolution will come after implementation and evaluation data. I'm going to give my opinion. You can give yours. I would say this is a twofer, and this is an example of a marriage of program implementation and data and evaluation collection. So your program implementation, you actually resolved it by going from in-person to online. You need to honor that success. That was a big, big challenge that you've addressed. The issue is, you're quite correct, the jury is out as far as evaluation or getting the data in so that you can actually reflect on that data and do some action because of that. So this is exactly a great example of what we're trying to talk about, or what we are talking about today. Anything you want to add?
Well, I think that leads really well into the second example here, which is, oh, can you go back? There, thank you. The outreach canceled and reconfigured. So one of the things that is a hallmark of our grant is that we are doing outreach to communities, caregivers, family members, about caring for people with dementia, and doing outreach and educational programs around that. One of the things that we were doing was trying to visit every county in Minnesota to do in-person caregiver education. And we had a conference coming up that we expected about 300 people to come to a conference on caring for people with dementia. Both of those have been canceled. And we couldn't just put them online, because a lot of the people that were coming to these things can barely register online, or, they don't have computers. They don't, we're talking about a wide range of people, some of them caregivers, some of them, in their 80s and 90s. And so just going online wasn't something we could do. So that's one where, I'm recording that as a critical event. And to me, it's negative. There are a whole lot of people who aren't going to be able to gather together now and get this education. And we're working on ways to resolve that, but some of that just will not be resolved. It will be negative because some of those people, there isn't an alternative way. The reconfiguration that we're doing is we have partnered with the Minnesota Geriatric Society, Gerontological Society, to do a free webinar coming up in a couple of weeks about caring for people with dementia during COVID-19. And they're opening it up for free to everybody, not just members of the organization. And we are pumping that out to every list that we can find, and we're expecting thousands of people to be on that. So, and that's something that, we put together. We're extending the time that it normally is and inviting everybody to come together online to talk about caring for people with dementia during this time. So that, I would say, is a positive, but I don't want to lose the negative of the people actually being able to come together. So I would actually put those in as two separate critical events. One being the cancellation and the other being this reconfiguration. And then finally, a lot of people on this grant who are doing more face-to-face things have really shifted their efforts, and we're ramping up and pushing up the timeline on the curriculum development and enhancement that we had planned for the grant. So changing the timeline and getting everybody going on that during this time when everybody's home and can do it. And just circling back to what Barbara said, as I'm putting these into critical events of IPE, again, I have a record, not just of the categories, but everything I write about every single one of these things. So when it comes time for me to do my narrative HRSA report coming up, I'm going to go right in there and pull this right out. I have a timeline and I have my narrative pretty much written right there. So that's another really good reason to do it, is so that, I don't have to come in June and try to remember, oh gosh, why did we do this? Why did we do that? Why are we behind here and ahead of schedule here? I'm keeping track in real time so I can communicate that to my funder, as well as collecting a rich history for our program that we can use to improve and build going forward. So Carla is piping in here to say, we need to tell them how little time it really takes to record a critical event. Yes. It depends on how much you write, of course, but this is like 2 to 5 minutes. You pop in, you pick the categories. You write your description. Of course, if you want to write more, you can, but this is meant to be real time.
And you have a record yourself immediately.
Yes.
So looking at that time, yeah, what Sean, I'm going to take you from the boots on the ground, practical, to where we need to go next to building a stronger future of IPE, what we're going to be advocating for. And it's this collective wisdom when we have time. We are moving the summit, our Nexus summit in August, working on how we are going to engage in interactions. And this will become a major conversation at the summit, but we're advocating for a framework. These are the critical events, so the unforeseen that we are have identified. And then right now is how do we document the pandemic chaos? You know, what's the impact? What's important to us as far as boots on the ground? What might be going on in our health system, education system, and frankly, watching the regulatory environments. And then while we're doing that, we will look backwards a little, but needing to look, how do we seize opportunity in the future to build and reflect on and to build that stronger IPE in the future. So, you know, again, we've talked about local opportunities to capture data, but then this collective for building a stronger future. So somebody asked about a new date for the Nexus Summit, and yes, we will be, we're going to actually do more chunking, and we'll be putting that out very shortly. We're getting the final decisions made. Thank you for asking that question. So Laura, this will be your slide.
Yes.
Our discussion.
Yes.
We want to open it up to all the participants and have discussion.
So can we change the slide, Sean? All right, so we do want to open it up for discussion now, and I want to remind you to use the Q&A function that should be along the bottom of your screen. You can type in your question or your comment or whatever you want to say there, or you can just say, you know, I want to speak on this topic, and we can unmute you and hear your voice. So these are just some guiding questions. I won't read them to you, you can read them, but we do want to open it up to everybody here to react and to share and ask questions if you have them.
Really, two things, very good questions. So we want to open it up to Chris. You want to say it out loud, what your question is? Sean, can we?
Can you hear me?
I can, yay.
Okay. Sorry about that. Just still trying to figure everything out with this technology. I think this is really exciting, and I appreciate your efforts. I can imagine there's a lot of work that got you to where you're at right now with just even opening up this data collection effort. I'm wondering, as all of the users start putting their data into this, how will the overarching data be shared then with the users? So obviously I can go in and see my institution's information, but I imagine it would be helpful to be able to see things in aggregate. What do you imagine for that?
So this is a great question. We actually already have that programmed into the information exchange. Anything that we've, the assessments or the instruments that are in there already programmed with reports. So what will happen is we will collate, or it's automatically collated, and we'll be, if anyone who's participating, you will also get the aggregate of reports of all the inputs in. So it'll show you how many people answered in certain categories, what percentage and the like. In working with a number of sites throughout the United States when it isn't a pandemic, this has actually been a comfort for people to know that they're not alone. Yeah. And that things that they're experiencing are frankly often very common. And so we host ways to have those conversations and to, again, keep advancing the field.
Well, thank you. That is exactly what I was thinking about is, how does my institution differ and how is it similar in terms of responding to some of these situations? So yeah, it will be comforting to see that we aren't alone. Thank you.
Great. So Fran, Sean, I see Fran Velasquez has a question.
Am I unmute? Okay, great. Thank you. I had, Barbara, I thought that a few minutes ago you said something about developing a framework. I wasn't sure if you were talking about a framework for Nexus, the meeting, or a framework for this information that's being collected.
So a couple of things, and Sean, if you can go back to the framework and I'll talk about that. I'll talk about the summit first. So the staff, and Sean's one of them, Angela, Jenny, we have done quite a bit of research on the summit. And those of you who come to our summits and know that we have worked very hard, very diligently to design opportunities for interaction and interaction that advances the field. So we're staying true to the goals of the sessions that will be in the summit. And so right now, what we're doing is we're going to be extending those sessions across many days or several days rather than sitting for 3 days at a summit. So that will be released soon as we continue to finalize those decisions. The framework that I was not clear about that we're advocating for is, okay, we gather all this data, you get your reports, you're comparing to what's going on with others who have submitted the data. What's the big so what here? And so we'll be hosting collective wisdom. And again, when we have time. And looking at what's the data that's coming in, what's the stories that are coming in on these themes, and frankly, new ones. And so the framework is looking at what's going on today and comparing where we were in more normal times, and then really having the conversation, both for the field and you can have it locally. What does this mean for building our program and making it stronger? So what can be the positive impact? I also think in this framework, capturing the conversation that we've already had about, is this positive, or negative impact, or does it really have no impact at all? And then I think that part of this framework, we're going to have to look at both at the micro level or the clinical level, the classroom level and the like, what is going on in our health systems, and then what is going on at the regulatory accreditation and the like level. So this is the other framework that I was referring to. So another, Durham, I don't know the first name, want to ask your question about, or observation about social media. Sean, can we, so the question is.
There we go. Yes. Hello. Yes. Hello, it's Diana Durham from Stanford.
Diana, okay.
How are you?
Good.
Yeah, I have been noting that in social media, all kinds of social media, there are a lot more insights popping up, maybe because I'm connecting more with people who are not exactly in my profession. There's a lot more insight into teams working together. Recently, I read one, I think this morning on LinkedIn, celebrating respiratory therapists. And I thought, hell yes, you know. I would really be interested to hear if anybody else has begun to capture that kind of content for future needs assessments, where there's a sort of more of an opening to that concept, that it's not just the hands of the physician doing all the work, you know.
So this is exactly what Laura is talking about. This is a perfect example of, we don't know what it means right now, but capture it, because in the future we might know what it means.
So with things like, I am not a user of Twitter. I have political reasons for not using Twitter. And mostly I'm looking at, internet postings and things on the Alliance website, and now hopefully on yours, because I'm finding you're such a rich source of reflection and information. So I really do hope that you continue with these webinars. I think they're amazing. Thank you.
I'm going to call upon Karen Hansen, because I love the question. Karen, can you share your question with us?
Hi, can you hear me?
We can.
Okay, great. Thank you so much. No, my question has to do with duplications and dupes. How do you remove the dupes? If there are multiple people at an institution recording events, and the same event gets recorded, perhaps from a slightly different perspective, obviously slightly different language will be used, but it's the same event. And I just wondered how that would be handled.
Laura, you can give your answer. I'll give mine.
Sure. Normally in this system, we limit it so that there's only one person from a team who's really, and that's the program
okay.
who's really authorized to enter critical events of IPE to avoid that exact thing. However, right now, leadership is changing all the time, so it's who's the program leader. So we are really right now wanting to open it up to everybody. So that's going to take a little more manual work on the back end, probably, to see, okay, if more than one person from an institution is talking about the same thing, making sure that we clean up the numbers on that. But I think it's also a really great opportunity to see exactly what you said, which is the multiple perspectives. So we can clean up the numbers, but we still have the qualitative data of how 2 or 3 different people perceived the same event. And so I think there are some real opportunities there.
And there is no question that this is a very rich source of conversation. And typically the reason we limit the person who can enter for a program is the opposite of why we're opening it up. So yes.
No, thank you so much. That makes perfect sense.
Yeah, we're learning on, this is ambiguity. And so being flexible at this point, I think will serve us well. I think we have one more question we can ask, and I'm going to call upon Diana McNeil. Are you still on, Diana? If not, I will. Her question was about doing.
Can you hear me?
Yeah, we can. Thank you.
So I asked 2 questions, but I'll take the one that I think would help getting input from everyone about. Do we anticipate sharing these reports with our institutional leaders? And if we do, it may be helpful for all of us to think about an elevator speech that can help us have our leaders see the value of the data. And I very much respect one of the earlier slides that talked about the humanitarian response to a crisis and knowing when to share the data and knowing when to collect data, et cetera. It's been clear at my institution that they have recognized that priority. But I think it would be helpful down the road for some guidance on how to eventually take all this rich data and share it with institutional leaders, some keywords and other things. And then my other question, which is important professionally and personally for me, is may we not forget all those remarkable people that are working in New York City, Boston, New Orleans, Seattle, and probably don't actually have time to maybe fill out all of this information. It would be a shame not to gather from these remarkable folks that are in these hotspot areas.
Right. So when Laura referred to the we, about there's some of us who are sitting in our homes and how is it that we in our homes can help collect these stories? But you're quite correct. A colleague of ours is a family physician director chair at Thomas Jefferson, and she doesn't have time for a 10-minute call right now. As far as the institutional leaders are concerned, so just a little bit about that, and I'm looking at the time and being mindful of it, is that these conversation cafes that we've held at the summit collates a lot of ideas and comes to consensus on what are we seeing. And those have actually resulted in real action. So for example, the accreditation document that came out last year with the Health Professions Accreditors Collaborative with the National Center actually got its start in one of these conversation cafes. I could foresee that this effort with this collective wisdom will result in that. And again, we don't know what it means right now, but we do know that there's such significant change, and we will see the outcomes of it, that I think the collective wisdom of the group that's on this and other webinars with us will be important. So I'm going to close down this and have one more slide that I want to share with you, and that is on Thursday. Oh, we will be sending you a follow-up to this for if you are interested, how you can do the express registration and the like. So you'll get details. But I do want to share with you, as we have another terrific webinar coming up on Thursday, April the 9th, at, again, same time, from our teams to your strategies for successful remote teaming. And that comes from Arizona State University and their Center for the Advancement of Interprofessional Practice, Education, and Research. So we hope you join us for that. Again, we will follow up on this webinar, opening it up. There's another one next in 2 weeks. We will very much look forward to following up with you on this tool and answering any questions you might have of it. So thank you very much for joining us. I'm sorry we didn't get to all the questions today, but we look forward to collaborating in the near future. Thank you.
Thank you.